Obamacare is finally officially dead is something they can say once the bill goes to the Senate, then gets out of committee, is debated on the floor where amendments can be added, then the Senate votes on their bill, which is sent to conference committee where the differences between the two bills are ironed out, then voted on in the House and Senate again, then sent to the White House for the president to sign. Which is why Republicans were chanting, "We're number one, third of the way through a very complex process."
Almost every group is against this bill. The American Cancer Society, the AMA, the AARP, the AA, double batteries, AAA, Triple H, H&M, and Preparation H.
If laughter is the best medicine, late-night television delivered a dose of comedy on the House health care plan. Sabrina Corlette is a research professor at the Center of Health Insurance Reforms at Georgetown University's Health Policy Institute. If the House bill goes over to the Senate and, for the most part, remains intact, which we know it won't, who's going to lose? How many millions of people are going to lose their health insurance?
Well, Bruce, the amazing thing is the House voted on this bill without any kind of score from the Congressional Budget Office, which is the official scorekeeper of these kinds of things. So the honest answer is we don't really know. We do know there was a previous version of this bill, a little bit different, and the CBO, or Congressional Budget Office, estimated that 24 million people would lose their coverage as a result.
I read a lot and I watch a lot of the talk, political talk. Everybody's got their points to make. And I couldn't find one Republican who would dare to answer that question. How many people are going to lose their health insurance? Nobody would say nobody's going to lose it or it won't be a big number. They just refuse to answer that question.
Well, yeah, I mean, it's simple math, right? We've got, they're taking close to $900 billion out of the Medicaid program, which is the program that covers low-income folks. They're cutting the Obamacare subsidies for people to buy private insurance, particularly for people who are lower income, lower moderate income. When you take that money out of the system, of course people are going to lose coverage. It's just common sense.
Yeah. All right. They say they're giving the issue, the controls of health care, back to the states where they say it belongs, okay? What happens there? Why should we as individuals trust the states more so than the federal government in this?
Well, this is the system we had before Obamacare was passed. It was all left up to the states, and we had close to 50 million people without health insurance. As many as 40% of people who applied for health insurance were denied because they had a pre-existing condition or were charged such a high premium they couldn't afford it. So that's what we had in the states before the Affordable Care Act was passed. What the Affordable Care Act did was set a minimum standard for everybody that said no matter where you live, it shouldn't matter where you live, you're entitled to health coverage.
I would think there'd be quite a bit of pushback from the states where you got a lot of Republican governors because they're going to have to absorb this issue and a lot of the costs, correct?
This bill is asking Republican and Democratic governors to do less with less. So you look at something like the Medicaid program, and people think, well, oh, that's just the program for poor people. But half the babies in this country are born paid for by the Medicaid program. It funds nursing homes for senior citizens, for people with disabilities. These are all really tough decisions that state governors are going to have to make. Where do I cut?
If I've got a pre-existing condition, if I got somebody in my family with pre-existing conditions, how concerned should I be?
If you hang on to your insurance, you stay with an employer, you are either on Medicare or you're with an employer-based plan, you're not going to see big dramatic changes. You might see bigger out-of-pocket costs. You might, hopefully not, but you might actually see some caps on the amount your insurance company will cover. But for folks who are having to buy on their own, maybe their employer doesn't pay for coverage, I would worry.
Yeah, people working for small businesses that can't afford.
That's right. That's right. If you're an entrepreneur or you're starting your own business or you work for a retailer or a restaurant that just doesn't provide coverage, you could be left out in the cold.
Sabrina Corlette, thanks a lot for coming in.
My pleasure. Thank you.
Thanks for the information. Good information. Could the president be about to cut funding for those who need opioid abuse treatment? Next, what the White House had to say about this issue today.